Every one of you will be touched at some point in your life by critical care medicine, whether yourself or a loved one. It's not good enough. What does this lead to? Johns Hopkins University Medical School study estimates over 170,000 unnecessary deaths in the ICU in the US alone by uncertainty and the inability to predict the patient trajectory. The longer you stay in the bed, the more costs you incur, and that just builds on the inefficiencies of our healthcare system. And that's not sustainable in this day and age with, at least in this province, 45 cents of our dollar going to healthcare. Changes are coming to monitoring, I can tell you folks. Today, it's absolute values. Your heart rate's 80 beats per minute. It's point in time. All they do is measure. You're tethered to the monitor. You got to be in the bed attached to something. And it's reactive. The doctor doesn't know what's going to happen next. He can infer, or she can infer based on their clinical judgment and intuition, but that's it. So where's it going? Where is monitoring going to go next? Through clinical decision support software, it's integrative. We're going to take all the data. Because right now, a Philips or GE monitor measures you constantly 24/7. Most of that data is discarded. No more. It's continuous, non-stop monitoring, not just when the nurse, the doctor happens to look, but all the time. It's mobile. It's got to be on an iPhone or an iPad. It's got to be. And it's got to be anticipatory. It's got to tell doctors what is going to happen next. Otherwise, what's the value? What we do is we bring complex science to the bedside. A nonlinear dynamics called variability analysis. And as Joe alluded to, we call it continuous, individualized, multi-organ variability analysis. So in our software, our system, we don't just look at the heart rate. We look at the heart rate, maybe combined with your respiratory rate. And in the future, SpO2, blood pressure. So it's a holistic view of what's happening to the patient. And we do it through our Simba software, which we call Simba Clinical Decision Support. And unfortunately, I don't really have time to go into the science in too great details. I will say I have a colleague here, Dr. Stephenson, in the audience, and we can definitely talk offline a bit more about the science. Okay, so what are we doing? What's our product? Why is Philips interested in other folks? We take data off the monitors that are there already. We're doing nothing different that's not already there. The monitors are there taking your data, folks. We just need to access it and read it easier and better. We run the waveform data, your heart rate, your respiratory rate through our novel Simba software. We do some fancy analytics. And we come out with what's called variability analysis. Because it's a web-based system with flexible deployment, it could be, like I said, on a doctor's tablet. It could be in the hospital intranet. Or maybe our remote Simba servers will do the analysis for you. It doesn't matter. The way things today are going in data transfer, our software is flexible enough to handle all of it. And because it's over the cloud now, it brings up a lot of interesting commercialization opportunities, such as SaaS business models, which again, I won't go into today. But most importantly, folks, it's anticipatory monitoring. What is going to happen next? Let's look at one quick example. We all know that in the ICU, many patients are on mechanical ventilation. They don't know how to breathe on their own. These are the sickest patients occupying the most expensive beds in the hospital, over $3,000 a day. You want to get them out to a general ward as fast as you can. Two patients. Patient A, 75-year-old male. The standard of care today, the way doctors operate today, is look at something called the Tobin Index. He scored 42. Based on the current standard of care today, is he ready to extubate, meaning take off ventilation? Absolutely. Off he goes. Patient 2, same demographics, very similar Tobin Index score. Is he ready to extubate? Doctors say absolutely. That's the standard of care today. There's no real test. It's more subjective because, it could be 42, 43, between 60 and 40, Sounds good to me. What do you think, nurse? Yeah, take him off. So what happens? This patient is successfully extubated, taken off mechanical ventilation. And why is this so important? Because if you fail, if the tube comes out and you can't breathe on your own, they got to put the tube back in you. What that does is increase your mortality 25%. And on average, you spend 11 more days in the hospital at $3,000 a day. So you can imagine why hospitals don't like this. This is a huge problem for the patient's family, and the hospital bottom line. So what does Simva software see when we ran this patient's data? Very complex variability. So we agree with the doctor's intuition in this case. What about patient number B? Same standard of care, looks all the same. He failed. This patient is the one that has to be reintubated, back on ventilation, 11 more days, et cetera, et cetera. Simva showed that his variability went down dramatically, so we disagreed with the standard of care. In other words, we provide anticipatory information that doctors can't do today on their own. We operate in a massive sandbox. Our market potential is massive. Millions of patients going through the ICU, thousands of ICU beds, millions of ER patients. They all need clinical decision support today. And they're all on monitoring, at least in the ICU. So the data is all there for us. We're targeting two key needs quickly: severe infection and extubation, as I mentioned. Big numbers, unacceptable death rates in the year 2011, and the cost of the system is massive. Those aren't our market data. Those are costs to the healthcare system. Our two lead products, quickly: Simva Sepsis Advisor to help ER doctors triage you to find out, are you at risk of more infections developing quicker? So the choice is, do I give this patient Advil and send him home, or do I give him fluids and antibiotics now? Today we don't know. They don't know if you should be A or B. Simva can tell you. And the last one is Extubation Advisor I just described, when to take you off ventilation. Big total addressable markets, combined over $700 million a year in the US. And these are just two of our first products. Quickly, our go-to-market strategy: we're developing our own Simva software platform for direct applications in hospitals through a SaaS or remote distribution channel. We also want to partner with big monitoring companies. They provide capital, technology, and commercial channels, which are important for an early-stage company, as our colleagues at Queens can attest to with Veolia. Who are our partners? Here's a quick snapshot of the major multi-parameter monitoring market in North America. You see Philips and GE have the lion's share. It's almost $1 billion marketplace, very concentrated, but it's a commodity. Like I said, it hasn't changed in 30 years. Mindray out of China is competing on price. Philips and GE need clinical decision support to make themselves differentiated. In the US, in fact, the Obama administration has a thing called meaningful use, where hospitals now have to demonstrate that when they buy a monitor soon, they have to show it actually does something. As I mentioned, we signed a co-development, we have reached agreement on a co-development arrangement with Philips Healthcare, the #1 monitoring company globally. In March, we will be embedding our Simva software in one of their monitoring lines and running pilot patient trials later this year. It's a phased program over the next couple of years to get a product with our Simva software embedded into the commercial marketplace. As I mentioned, it's good validation of TMS and the Ottawa Hospital's technology. It also suggests that based on what Philips sees globally, that a company out of Ottawa, Ontario has world-class technology that they can't find anywhere else. And finally, just to finish up quickly, our funding to date, we've raised about $700,000 from investors, angel investors in Ottawa, Toronto, and the Bay Area. But most interestingly, and why I think it's important to talk about technology transfer partnerships, we've leveraged investor money almost 2 times with government and non-dilutive money. CIHR has funded our clinical trials. Ontario Centers of Excellence have been very supportive with us in business plans and commercialization plans. Ottawa Technology Transfer Network has been very, very useful again in the early stages through their POP 1, 2, and 3 programs. I want to thank Joe for that. And IRAP, if anybody's from IRAP, we have a wonderful ITA, Bob Reichart in Ottawa, who's believed in us and has helped us and helped this year build our software team. IRAP funding actually paid for 2 developers and a quality management system tester, and they've been very, very helpful. We're seeking $1 million currently in our seed round, and that gets us to FDA approval by mid-2012. And just quickly, the team, we bring clinical expertise, software expertise, FDA regulatory approval expertise, and the know-how to take a technology out of the lab to the marketplace. And finally, just the last slide here on the partnership aspects. They nurtured Andrew. OHRI, when he joined in 2004, he went to the Dean of Medicine, explained his concept, showed him his patent application. They bought the story. They gave him the lab. They've allowed him to slowly build the prototypes that he needed to convince us there was a commercial opportunity here. We've licensed IP now to the Ottawa Hospital, OHRI, and I will say, Joe is being too modest. The deal they gave us is not just a deal that helps us, it's also a deal that we believe is investable by the street. It's a market-friendly deal, and that's very important when you talk to tech transfer office people. The deal's got to benefit the two companies, yes, and the institution, but can you finance off that plan? And that's very important. And finally, as I mentioned, they've pointed out funding opportunities to us in the past, such as OTTN, and most recently MyTax, which there's a booth I saw, which allowed us to hire a postdoc student in our lab for the next 2 years. So that's about it for now, and thank you for listening to the story. And as Joe said, I hope to be back in a couple of years to tell you all the good things that have happened with TMS. Thank you.
Thank you for coming today. I just want to thank OCE for actually inviting us and giving us the opportunity to tell everybody about the great success that we've actually had with the college side of the equation. Also, I want to thank everybody for coming for our coming out party. Hopefully you got one of those little blue tickets for the refreshments later this evening. But this is a big, really big deal for us actually to be here today. Just to give you some, what I'm going to try to do is quickly go through in terms of what our company is about and the big part that Centennial and George Brown was also helping us out. But Centennial is going to be playing definitely a big part now and also a future role, just because of the focus that we're trying to both get into. So what our company is about is basically on the micro power applications. It's interesting listening to all the other discussions that are happening here, because I'm sitting here with my iPad, and what makes this technology available is what we're really trying to take to the power industry. So we are the energy story that's been basically presented here so far today. If anyone's driving here today and looking at all the construction that's going on, some of the big things that's happening today is old infrastructure. That's a big part in terms of some of the market forces that are happening to make what we're trying to do possible. The trenching costs alone, what people really don't realize, if you look at the actual cost of the one application we have, which is streetlights, if you take a look at what the real cost of ownership on that is, the biggest part you have is the infrastructure. One of the applications that I'll get into, a lot of the infrastructure right now, especially in North America, is 20 to 30 years old, i.e. that's why there's a lot of holes going around right now in Ontario and definitely in Toronto. The other thing that's happening is commodity prices. Commodity prices, I was talking to a contractor recently. I mean, you look at the copper prices, it's almost doubled just in the last couple of years. That's a bonus for me in terms of what I'm trying to do. We're trying to get that infrastructure out of the ground. The bonus that happened to us recently is in LED lighting. So adoption of LED lighting is coming, especially in the streetlight scenario. Still in the early adoption, but it is definitely a market force that's coming. Solar panel costs. So the whole smart grid and what's happening in Ontario has been a big driver to take the cost of panels down by at least half that it was 5 years ago. So if you look at all those factors that are coming into play, the idea of taking your actual point of use application and taking it off the grid starts to make a lot of sense. Where we start to come into play, once again, comes back to an example what the iPad is all about, in the sense that communications, wireless communications, easily accessible, low cost today. Data collection, data analytics. We'll be starting to generate a lot of communications from these poles in order to measure, monitor, and control. And you'll hear a lot of that when it comes into the whole smart grid movement in terms of what's happening. Downer Grove is an installation by the OEM partner that we have today. It's a 25 light installation in Chicago. They took a hard look at whether or not to do normal infrastructure connections, and they looked at this option in terms of taking that streetlight off grid. And what they found was, and they crunched a lot of numbers, is that capital cost up front was a break even. But then after that thing, you're not paying for any distribution costs on a monthly basis. You're not paying for any of the energy after the fact. So this individual site right now, and talking to this municipality, he basically says anytime he gets into a lighting application, he will definitely take a hard look at whether or not it makes the sense to go off grid. What are some of the applications, the other applications that we're getting into? Once again, streetlight was an obvious one. We fell into that one rather quickly. Security. There's another application that we're working on right now, two applications actually. The one is a security camera application where it takes 100 watts to run this thing continuously. In energy conversations, that's a lot of power to actually support off-grid. There is now a German company coming out with a camera that's like 10 watts. Or less, 7 to 10 watts, to do more than actually what that old application actually does. So we are starting to get into that situation where application loads are coming down, which is a double bonus for me once again, because it's less energy that I have to store and provide on a reliable basis. Grid tie is actually one that I had to get pulled into a little bit, but it's definitely a big movement that's happening. And you'll start seeing, if you start doing searches on the internet, there's installations that have been done in New York. There's a couple of companies that have come out that are doing these very similar to the picture you're seeing here. They're just putting micro inverters onto the grids, just put them on and go. What most people don't understand is when you look at street lighting, it's not measured and it's not monitored. So to take this to the next level is a big thing. People taking control once again of their energy, their consumption, and knowing what it is. That's the twist that I'm going to bring to that grid time marketplace. If I'm already there doing the level of conversion that I'm doing, within our own system, we've developed communications where we will be able to measure, monitor. We will actually also be incorporating load control. If I'm also there, there's probably going to be a street light. You might as well be able to control it and measure to see if the light's on or off and measure the energy consumption that's being used. You start listening to when generating data, what does that allow you to do? There's a lot of intelligence you can start to bring into this. If I'm measuring and monitoring the street light, I can now measure life of that street light and how long it's going to survive or live. I can probably predict when the end of life will be on that. Same thing if I'm into a battery situation and any of the electronics that's on the pole. How we're doing that, once again, is with our own mesh networking. It's nothing that we've tried to invent per se. It's basically using a technology called Zigbee, which is actually being wide adoption in the smart meter applications. So it's something that we've developed and are using within our own system to communicate that information back. When you look at that street light, it looks simple, but once again, I am touching onto the wind turbine, the solar. I've got a storage device that I have to take care of, and I'm measuring, monitoring the light. What I try to do as a company is make it easy for an end user to know that that system is working properly, and can be serviced. I can troubleshoot from my office on if there are any issues. I can be proactive before there's actual issues happening on that device. Lighting is just one of the applications. It was interesting to watch the presentations that were being done and actually hearing some of the conversations that are happening here. We were very lucky early on to find a strong OEM partner, which is Stresscrete. Their goal in life is to sell lights, all the hardware with it, and LED lighting. What we do for them is make them easy to go to market with an off-grid solution that isn't going to be a headache for them down the road. Because once again, I can take care of all the monitoring and servicing of that pole once it hits the field. Their job is done, and basically we take over in terms of operation and maintenance on that pole. We have an interesting partner that's in Turkey. That company was Nano. They originally brought the original proposal to us. They came across an application where 30 kilometers of highway was being placed in a hybrid off-grid streetlight situation. It's actually one of the things that's really kicked us off. North America will be a market for us, but the world's a big place, and getting those connections and international connections are something that's really going to launch us in a large way. There's already adoption going on. It's just how to do it well and how to do it smarter. Some of actually I'm lucky because on Sunday I get to go down to California, to Southern California Edison, and we'll be installing one of our grid tie systems down there to start their evaluation on the product. Mercedes, we can definitely see that early adopters, what will be happening. It's great to look green. This is probably one of the nicest looking green things you could put up in your front yard if you're a large corporate customer. And now we'll be generating the data to show them the green value of that type of a solution. So this was one of the key things in terms of, I thought, what the presentation was in terms of what people would want to hear. And I've talked to a number of companies in terms of how have we evolved as a company and how have we gone to market. And some of the key people and organizations we ran into, first I had my partner Netta, who came with this application saying this is real and it's really happening out there in other continents. We did our own market assessment. We did our own, what's happening in terms of market forces, and we decided it was real. So we started to go ahead on the project. Very early on, and it was basically by word of mouth, though, we found Mars. And Mars is definitely going to be a part of our life for quite a while. There's a lot of resources there, and if people aren't aware of it, you should definitely visit their booth and talk to them when you get a chance. But they first put me on because of IP. What IP do you have? Can you protect it? Send me to Deloitte. Deloitte, as we went through that discussion, just happened to hear about an organization called Connie. So next goes the phone call, and I'm talking to Vanessa Williams. And if anybody doesn't know Vanessa, and you're interested in this, she is definitely a great contact to have. That gave me immediately access to over 20 colleges. So in that project, it was basically present 5 different things that you need to get done in order to get yourself to go to market. And that's what we did. We had 3 colleges that immediately came back that were interested in this wind, solar, storage space, LEDs. And we ended up going with 2 colleges. We had George Brown, which is basically doing product testing for us. And Centennial College, we started a marketing and a modeling program for systems development, which has been a huge success for us. It's just been a huge success for us. And where it's going, I'm assuming Trish will probably go into it next, is what they will be for us is a huge resource on micro wind testing in terms of different turbines and learning more about that whole segment. There will be definitely IP for us down the road. Once I start to get 500, 1,000 poles, I will have data which no one else will have on this planet based on that type of application. And it will just go beyond there in terms of what we'll be able to do in terms of improving our systems, improving the storage and the communications. So from here, I'll pass it on to Trish to give her side of the success story.
Okay, so I have about 30, 40 slides to go through. That's okay? Oh, no, maybe not. All right, I'll try and speed this up and tell you a great success story. As you can see from this slide, what we've called this is competing to survive, collaborating to thrive, and it's why companies would come to colleges to partner. The take-home message, in case you have to leave early, is continuous innovation is critical for companies, such as John's company. It leads to productivity and jobs, and the only way we're going to get there is through collaboration with industries, universities, teaching hospitals, and colleges. That's Centennial College, in case you don't know us. We're out in the east end of Toronto. We're in Scarborough, and that's one of our 4 campuses, which is our technology, science and technology campus. And one of the reasons why companies come to a place like Centennial College, we have 15,000 full-time students, 22,000 part-time students. We have more international students in our midst than any other college in the system. And 50% of our students, and we're very proud of this, are first generation. That means they're first past the post in their family to get to post-secondary. It's very important that they learn to be innovation-ready graduates. And 50% of our students come from around the world and around the country with degrees and diplomas already, and they're looking for industry experience. So it's a perfect match, industry innovation and students at community colleges. The Applied Research and Innovation Center, this is a relatively new phenomenon in colleges, and we started in 2003, but really got the wind under our sails in 2006 when Ontario Centres of Excellence, through Ministry of Research and Innovation, funded the first iteration of CONI, or the Colleges Ontario Network for Industry Innovation, and funded 10 colleges in the Windsor-Ottawa corridor to open industry innovation centers. So it wasn't trying to phone somebody at the college to try and figure out who you should talk to. If you were an industry partner, should I go to this department, that department, which school? We have 8 schools, 4 campuses, 7 satellites. Who are they going to talk to? They could talk to us in the Industry Innovation Center, and when they did, our role is to matchmake them with the right students, with the right faculty to answer their problem. It's not driven by our faculty interest, it's driven by industry's interest. And so these are very solution-focused, incremental, bite-sized problems that we can chew off, work on with our students. The IP rests with the company, and what's in it for us? Innovation-ready graduates, and we're going to come back and bug John when he's made his first, what billion did we talk about? Is he can name a building for us, that's fine, in fact he can buy the building, but actually what we're going after is scholarships for students, because what we want out of them is you be the most successful company you can be, you hire our students, and you give us money to help our students stay in school and get the industry innovation skills they need. So that's where Connie in round 2, we did 3 years with Connie, 10 colleges. Round 2, very innovative on Ministry of Research and Innovation side and OCE, that we started into round 2 of Connie, and that is now 20 colleges out of 24 colleges in Ontario have these industry innovation offices, have the same kinds of services that we provide, and I can tell you right now, if a company calls us and we don't have the expertise, we put them on to George Brown or to Algonquin or to Fanshawe or to Niagara. And that's why we work, because we are a network of industry innovation. So then Blue Heron came to us, as you said. They contacted Vanessa Williams, who is the executive director of Connie, and she put it out on the website that we should be able to bid on this. 3 of us got interested. And of course, we got really interested because we have wind turbines, and we have solar panels, and we have the programs and the technology programs that people are building these things, servicing them, developing them. We have these things. So then we have the team come together. We won the bid to work with this company. We leveraged funding through the Colleges Ontario Network for Industry Innovation. So basically, John had to put in-kind and expertise on the table. We put the faculty know-how and the student know-how. And the student know-how is, you have to understand, we have students from all over the world and faculty from all over the world who are bringing amazing, amazing skill sets and knowledge base to bear on these problems. And that's the team. And I wouldn't mind if the team right now just stood up. Team Centennial, I know you're here. Thanks, guys. Excellent. And the team included Donald Wang, who's chair of AMAT and CTAS, Krishna Raghavan, Mihail Pleska, Sardar Sadiq, and then 2 amazing students worked night and day on this thing and had so much fun doing it. Well, how much fun did they have? Well, you know, they get to fool around with high-tech equipment and do modeling and, you know, fool around some more, and we really hope that the safety things were on there. And then they had some really great ideas. And they get really great ideas. They're not working at of course, they're reading their textbooks. Well, they're reading them online. But they are working on real-world problems. What could be more interesting for a student and better for them? And besides that, John is now test driving his future employees, right? He's going to hire these guys. So then Blue Heron we gave him some ideas about what they're doing. And the key theme here is collaboration, is that we work closely with them. Why? Well, from John Brakey, who's the chair of our industry PAC for Connie, has said, if companies aren't in the business of continuous innovation, they're going to be left behind. And one of the ways they can do this is by leveraging the expertise that resides in colleges. If you want more information on this, we've had a lot of our performance metrics looked at about what colleges can do, and the Conference Board of Canada produced a very interesting report this year called Innovation Catalysts and Accelerators about this interesting experiment that's going on in Ontario about how to utilize the nascent abilities that are in the colleges that we need to accelerate and now really scale up. And this is why we do it. Yes, we want John's company to be fantastically successful, but we're doing it for these guys because they are our future, and they are who are going to be working in these companies and produce the new products and processes, improved processes for the future. And with that, I thank you.
Are we live? Thank you. So you've heard from a range of companies here. You've heard from universities and colleges and hospitals. You've heard from Queen's and ENDETEC, focused on water. You've heard from Ottawa, both from the university and hospital side, and TMS, focused on healthcare IT. And you've heard from Centennial and Blue Heron, focused on power. So a wide range of different areas here. And I'm now going to throw it out to the floor. There's a mic in the center over there. This is your chance. Those from academia. This is your chance. Those from hospitals. This is your chance for those in the industry to actually get an idea of what the trials and tribulations are these people have gone through. So we have one question coming forth there.
I'm from the media. Adam Bruns, I'm managing editor of Site Selection magazine. We cover where companies go in the world and why. And companies, our readers, are very interested in IP control or lack thereof by the institutions with which they work. I've heard just anecdotally today from a number of people in institutions where it seems like it's a pretty liberal policy on the part of a lot of institutions in Canada with regard to IP control retained by faculty, by researchers. I'm wondering from each of you what your sense is of how the ease of working with institutions in Canada is compared to other international jurisdictions.
There are 3 mics down there. If you want to go ahead.
Well, I think there's quite a range of different ways to interact with IP and industry, and from collaborative research through to technology development. And I think that across Ontario and Canada, there's several policies at several institutions. Really, I think the critical issue is what is the transaction cost? How long is the deal going to take? Not the ownership per se, because there are various models work in various transactions. If the time of the transaction is predictable and low, the deal will work.
I think I totally agree with my colleague, it depends. Mostly in colleges, however, the IP will remain with the smaller, medium-sized enterprise that we're working with, because they're usually coming in with, that's all they own. If it's something over time that we develop and we will develop that relationship, then there may indeed be some aspects of shared IP. But for the most part, because we're on the development end of the project often, that the ownership will reside with the business partner, but what we try and do is provide sort of full service to help them exploit that IP by getting them in touch with Mars, by getting them in touch with various organizations through the One Network, through RICS, so that there is an ability to continue to exploit that, because often they're not sure how to do that, how to break into that. And the other piece that we're very interested in is providing market intelligence. So our business schools, for example, will help them look at those issues. So we're often on the earlier end of that whole innovation cycle.
If I can throw a point in here too, the company that I run actually was spun out of a university, and some tech transfer departments viewed their big value coming through as purely their ownership stake in the company, or in a lot of cases, really the royalty stream they get back. I think somebody talked about this earlier. It's actually hard for a small company to go through and raise funds if you have IP that's licensed for an institution. If you own it, it's been assigned, and you take the institution takes an equity stake for it, it's a much cleaner way to go through and do this. And the value of the institution is not just the royalty stream coming through. As Trish was saying, it's you get a chance to hire people from that institution. So our company is funded at U of T. We've hired 14 grads from U of T in the course of the last 3 years. So there's tremendous value there, and we do a lot of work back with a huge range of institutions, and we basically write grant support documents, so they're getting a lot of additional value from things like that.
I'll echo that, since John, who runs Partech, is looking at me wondering if I'm going to say anything, I think, at this point. I'm just interested in the question being phrased in the way of saying that IP policy is liberal, and I don't know if liberal means liberal in the American bad sense, or if liberal means progressive. And we won't get into local politics, it's an election year. But you know, I think maybe the better term is that what university tech transfer offices are learning, I think, is that IP policy has to be flexible. You know, there are going to be some situations where, you know, for the university to own the IP and depend more on a royalty stream or licensing approach is going to be better for that situation for whatever reasons. There'll be other situations where the IP is better resided in a smaller or medium enterprise, in which case, you know, the university is going to have to figure some other way of getting their value out, whether it's taking an equity stake or whatever. So I think what we need to get used to is university IP offices having to get a lot more sophisticated in their ability to cope with IP, and then researchers like me working back in the lab have to then get tuned into how an IP office is going to work and support you in the long term, so that you are also in sync with them before you're publishing stuff or disclosing stuff and so on. So I think once all of those processes get going, then the people involved, the stakeholders in any particular activity, have to look at each other and say, okay, for this situation, what's going to work best, and try to come to a way of doing that. So don't look for one formula for how to manage the IP associated with a technology transfer project.
I'd like to make a comment, so I'll use this mic. It's easier than walking over there. I've been involved with the tech transfer for quite a while, nearly as long as Joe. I mean, it's just amazing. But we're both kids, really. But throughout that time, and you can argue with me if you like on this one, I've never had a deal actually collapse because of IP. I've had them collapse over many other reasons. But IP, you know, if there's a real deal there to be made, the IP doesn't usually become an issue because you'll make it work. So yeah, there are policies. There is a huge range just across Ontario, let alone across Canada. But really, it's a bit of a red herring. Too many people go on about IP policies. As long as you've got people with goodwill that want to put a deal together, the deal will come together. Go on. Now John will argue with me.
I'm going to say a few.
I was sitting here. I wasn't going to say anything, but I would argue with the point that you should assign the intellectual property to the companies, because a lot of investors actually look to the universities as the source of deep pockets, although there may not be anything in the pockets, to actually protect the intellectual property if challenged by anybody. And most small companies I know, if they ever get challenged on their IP, have no resources to actually litigate, whereas the universities in some cases will do that.
It's a very good point.
Although I think the depth of pockets at universities for that varies substantially. In our office, we like to say we're about VIPs and IP, because the deals are dependent on the nature of the state of the project, the company we're dealing with. We just did a bunch of projects through the FedDev Ontario program where the university had no IP. So it can work as long as everyone understands what the process is and everyone has the same outcome. The outcome can be industrial interaction and commercialization, and not IP monetization.
Yeah, and I'll just to clarify, the OHRI did not assign the IP to us. We've strictly licensed it as well. But I will say that it's key that if you're industry or you're coming to this and you're new, don't think you can do this on your own. If you don't really understand intellectual property law, please employ a professional, a lawyer that understands the ins and outs and the minefields, because what you sign up front today can totally, pigeonhole you down the road, okay? Because when a company comes to look at you down the road as an acquisition opportunity, or there's a VC that wants to fund you, or a sophisticated angel, they'll look at your IP agreements. They'll see what's wrong with them and what's right with them. So up front, you want to think through scenarios, and I encourage you, please, to use a professional as best you can. Because as I mentioned in my talk, you want a deal that's fundable. You don't want a deal that just makes you feel good at the tech transfer office, because that's going to wear off. Then you got to run your business.
Since we don't have questions right now, I want to ask you a fairly simple question. What has worked and what has not worked in the process?
I think we've listed a lot of things that worked, but one of the challenges, things that don't work in hospital research commercialization is conflict of interest, apparent conflict of interest in clinical trials, incubating companies. Those are structural challenges that are very labor intensive, that are unanticipated in the timelines of the funding. So the more knowledge you can bring to the table at the outset when you're incubating a company, the easier it is to do.
I think one of the big challenges we've faced, and it's not something that didn't work because we're still here, so obviously we were able to overcome all our challenges so far, is timing. You'll go through phases where research, for instance, will be on an academic cycle of 3-ish years with a certain structure that all research proposals have, that start with a very innovative experiment no one ever thought of until I started writing this research proposal, and 3 years later there's a commercial product ready to go to market. And so that, that's one thing going on its cycle. And then on the industrial side, there's the cycle of adopting technology, figuring out how it's going to be incorporated into the business, figuring out how to commercialize it, and then, of course, raising money. And when those get out of sync, then you end up with a critical research core in your operation that's not funded for a while. And I'll thank John for helping us out from Partech and funding us in one of those stages. And then, at the other hand, the company will go through a stage where they're raising money and now they're ready to go, and the research isn't quite at its latest milestone. And so I think that there's no way to avoid this entirely. So I think both groups understanding that and being in dialogue and working together to get through the slow periods, or to try to understand the matching in the timing of the different activities, is critical for groups working together. Ultimately, it comes down to communication and networking and really getting along and treating it all like a complex relationship, which is really what it is, and realizing that that's what you're getting into at the start.
Great comment about timing. Is the mic on? Yeah. Great comment about timing. And colleges experience the same kind of thing in our industry innovation offices, because we will get one group of students working on a project and then they graduate and then we can't fund them. So we need to bring in a new group of students. So a lot of this is about very carefully scoping out the projects and knowing what our own limitations are, so that we are able to not offer more than we can actually do. And then to actually be able to deliver on that, we have to be very clear at the nitty-gritty of the project development, and really seeing which pieces are going to be done well, when, and ensuring that that happens in a very timely fashion. Because we're finding, certainly in the companies that tend to come to colleges, is that speed to market is the absolute essence, that we have to, anytime anything slows the process down, whether it's applying for new funding, whether it's finding the right kind of investment, is so problematic for these small companies. And that's the area that we all need to work on collaboratively. And I look forward to increased relationships with the university colleges, that whole sector, working together on the pieces that are that we can share in this project to move forward more quickly for entrepreneurs who need to move their ideas to market so quickly.
Make one quick comment. Speed to market was totally on our mind when we went into this thing. The one thing that did work well with Connie, and you kind of hinted at it, when we had 20 colleges taking a look at us, when the 3 came back, it was almost like a shopping list for myself when I was looking at the colleges. So I was also looking for strengths and weaknesses in terms of first meeting individuals. Networking is huge. Can't say it enough, networking is just huge. And organizations like Mars and Connie is just a fast way to try to make those contacts in a lot of different ways. And one of them is how to do the funding, how to get the appropriate resources. It's still early stage. Like I look at Connie was, I think we talked about it before, I think there were 6 colleges not that long ago. Now it's gone to 20, so it's definitely going in the right direction. In my areas of expertise though, I can see even colleges and probably universities scrambling right now to get caught up with what happened with FIT and solar and wind, and it's still a catch-up. So that's just all my.
We're coming to the wrap-up for a session. So do any of you have any final comments you want to make before I bring Bradley up here to close up? No?
Okay, great. Well, I must admit I enjoyed that. I'd like to thank all our panelists, and I've got them all written down because there's no way I'd remember the names. Stephen Brown, Dave Dolphin, who has wandered off, Simon Goulet, Joe Irving, Trish Dryden, and John Tuerk. And I'd like to thank you all for your excellent presentations. I've really enjoyed them. You brought the whole thing to life. I was especially happy. I must admit, I was one of the people who looked at the projects at the beginning, and we wanted to get a blend. We wanted to see stuff from different sectors, from different universities, from different parts of the province, and I think it worked. You guys really put it out there and did it very well. I'd like to thank you all very much. And